Good morning. I'd like to call, call the meeting of the Minnesota Senate Health and Human Services Committee to order. It's Wednesday, February 12th, and we do have a quorum present, although we aren't taking action on any bills today. Today we have the privilege of hearing from the university and from Essentia. We have kind of two parts to the presentation. First, we'll hear an update from the University and Essentia Health on their work together. And then we'll hear from the University of Minnesota on their strategic plan and their legislative requests that they're planning this year. So I'd like to get started with the first part of the presentation if Dr. Cunningham and David Herman can join us at the table, and I think the slides aren't displaying, but they don't have slides. Okay, great. So welcome. I really appreciate your coming to our committee today to talk with us. Some members are very interested in this topic, and we spent time, about a year ago reviewing the Academic Health Task Force recommendations, and now it's very interesting to hear how things have progressed. And again, welcome. And are you presenting first, Dr. Cunningham? Thank you. And if you can please take a little time to introduce yourself and to the committee as well. Thank you.
Well, thank you. Good morning, Madam Chair and members of the committee. Thank you so much for having us here today. For the record, my name is Dr. Rebecca Cunningham, and I'm the president of the University of Minnesota.
And I am Dr. David Herman. I am the CEO of Essentia Health.
We are just delighted to join you here today to discuss a topic that is near and dear to our heart, health. Many of you know, before I joined the University of Minnesota as its 18th president, I spent 25 years as an emergency physician, taking care of patients at the bedside, working with communities to keep children and families safe, and serving in leadership positions at university medical centers. So I tend to see the world through a health lens in the broadest sense. Here in Minnesota, we are at an inflection point. Our state, like countless others across the country, faces so many healthcare critical challenges, many of them mentioned in the report that you noted, from increasing costs, limited access, and declining reimbursements, to workforce shortages and structural inequities that amplify health disparities. Minnesotans have said loud and clear that healthcare needs to work better for them and for their families, and we hear you and we agree. As one of America's leading public research universities, we have a great responsibility to the people of this great state to generate new knowledge, to train our future workforce, to develop new innovations, to drive economic growth, and to most importantly, improve the health of all Minnesotans. I've had the opportunity to meet with some of you on the committee and your legislative colleagues, and I've listened to you, and you have said the university needs to help lead here. Senator Abler, I believe it was you who said we need to come to you with a solution. And we have done that with our proposed vision here. It is indeed a new path forward. Together, the University of Minnesota, Essentia Health, and Fairview Health Services have been in conversations towards a bold vision for Minnesota healthcare. A new Minnesota solution is proposed that combines our people, systems, and capabilities to deliver a new level of seamless, expanded healthcare across the state. But what exactly does that mean for Minnesotans? Well, for starters, our proposed framework goes far beyond just the formation of new partnerships. It helps us re-envision the future of healthcare for Minnesota. This new model would help Minnesotans enjoy more comprehensive care delivered closer to home where patients need it the most, especially in rural and tribal communities that have fewer local healthcare options. The proposed framework for this solution would preserve the existing doctor-patient relationships across our systems. So many good people work all across our systems every day, while delivering unrivaled benefits of a leading public research university, from increasing access to cutting-edge diagnostics all across the state, increasing access to advanced treatments, to specialized care, and to innovative clinical trials taking place every single day. For the healthcare professionals who provide tremendous care across our state, this approach would create new opportunities for them to build fulfilling careers. caring for Minnesotans and folks who travel here for exceptional health care. Long-term, this proposed solution would also decrease clinical costs, allow more sustainable and innovative models like home health, telehealth, and pharmacy services to flourish, and scale expensive healthcare technology for use across a larger system. Simply put, our goal is to infuse the very best what the University of Minnesota and Essentia Health have done for decades, to expand and extend our shared strengths in service to the state's greatest healthcare needs. We're talking about a newly proposed vision that would fundamentally enhance the structure of healthcare delivery, one that would include current services and facilities offered by Essentia Health. Our proposal includes University of Minnesota physicians and University of Minnesota Clinics and Surgery Center. We've also invited Fairview Health Services to join us in forging this new identity as a reset and building a new day on the work that has been done in the past, so that together we can create an integrated and seamless system of care that best supports the health and needs of Minnesotans broadly. To clarify, this new proposed vision is fundamentally different than the current structure. It would not be another joint transactional venture. It would not be a joint venture with Essentia that is similar to the structure of our current joint clinical enterprise, which is very transactional with Fairview. Rather, Essentia and the university would be coming together to build on the momentum and good work of all of those in mHealth Fairview, to form together a new integrated healthcare system that operates as one unified academic healthcare entity. With this new system, we could enhance and expand care across Minnesota, improving healthcare quality and access for patients across the state. The newly proposed All Minnesota Health Solution would invest $1 billion over 5 years to bring this vision to life. No additional taxpayer dollars or state legislative budget funds would be requested to make this initial transformation possible. Admittedly, we are still in the early stages, and there are many more transparent and comprehensive discussions to be had. And so as we move forward, the voices of patients, providers, and Minnesotans broadly will play a vital role in this process, as it must, because this impacts the public health of all in the state. We have also engaged in conversations with the Fairview CEO. Much more work needs to be done to make this vision a reality, but it does propose a course to chart that aligns with the nonprofit mission of Essentia and the land-grant mission of our university to best serve all Minnesotans. Dr. Herman and I have had so many productive conversations over the recent weeks and months. Our newly proposed vision for healthcare has already generated many positive reactions from people across our state and across our systems. Leaders every day and everyday Minnesotans alike are excited about our shared vision to ensure that this state remains home to exceptional clinicians, as well as a strong and vibrant University of Minnesota medical school, which trains 70% of the physicians in every health system across the state. I'm very excited to partner with Dr. Herman and his colleagues at Essentia Health, as well as Fairview President and CEO James Hereford and his colleagues, so that together we could build and transform healthcare delivery for the betterment of Minnesotans. Before I turn things over to Dr. Herman, I want to reinforce that our values remain consistent. We will continue to provide high-quality, accessible care for patients while supporting the tremendous health professionals across our organization so that they can do what they do best, which is care for patients. Thank you.
Thank you very much. And Dr. Herman, please.
Thank you, Madam Chair, members of the committee. Again, I'm Dr. David Herman, CEO of Essentia Health. It's really an honor to be here today in front of your committee along University of Minnesota President Rebecca Cunningham. We truly appreciate being at the table for these discussions, sharing our expertise in rural healthcare so we can best support the patients and the communities we're privileged to serve. As a member of the Governor's Task Force on Academic Health at the University of Minnesota, and through my experience serving Minnesotans through healthcare for many years, I'm well aware of the challenges we face as a state to sustainably care for Minnesotans and advance care through developing new care models. We are very excited for the promise and potential of this vision, building on the long-committed partnership we already enjoy with the University of Minnesota. We are confident that this partnership will address many of the concerns outlined in the Governor's Task Force, including a stable and thriving medical school and strong medical workforce. A little bit about Essentia. Essentia Health is headquartered in Duluth. We have almost 16,000 employees, 2,300 physician and advanced practice providers across the system statewide. In Minnesota, we operate primarily in northern Minnesota, including the districts of Senator Kupek and Senator Utke. President Cunningham has talked about building on our combined strengths to improve the health status of all Minnesotans. The university is nationally recognized for its medical training programs and cutting-edge research. Essentia brings to the table demonstrated its success in quality and operational excellence across a mostly rural footprint. In fact, more than 80% of our service area is considered to be rural. We are also excited to bring our expertise in value-based care, focusing on wellness and coordinated care to improve patient outcomes while reducing the cost of care. We know that healthcare is facing many challenges right now, and we are very eager to be part of innovative solutions. The long-term success of the university has an impact on all of us because we are dependent upon the caregivers who train there and then choose to provide care within our communities. About 70% of all Minnesota physicians were trained at the University of Minnesota Medical School. Our healthcare system reflects those statistics as well. And that's also a part of an important statistic for rural Minnesotans. While the number of physicians practicing in Minnesota has decreased 9% over the past several years, the number of practicing physicians actually increased in the metro area. This means that the loss of physicians is primarily borne by rural Minnesotans. Our patients benefit from a strong, thriving medical school educating the next generation of healthcare professionals. As we discuss our path forward, we recognize there are many more conversations to be had, including with our colleagues at Fairview. As we've been sharing our vision over the last few weeks, and people have said, well, it's really not fully formed, I'd like to point out one thing here. There was a time when our new state-of-the-art flagship hospital in Duluth was just a vision as well. Through a great deal of collaboration, a great deal of hard work, and great minds coming together, we are able to see that project come forward to reality and truly be able to serve the patients and communities we're privileged to serve in northern Minnesota. This won't be easy. Overcoming the healthcare challenges of today will mean embracing transformational change for a brighter tomorrow. While we're still working out the details to advance this bold vision, President Cunningham and I are happy to answer your questions as we work together to advance healthcare and aim to improve access and health outcomes across the state. Thank you, Madam Chair and members, for your time, your attention, and your support.
Thank you both for your opening thoughts. Members, I would like to open it up for questions. Nobody has questions. Senator Abler.
I just want to wait my turn. Anyway, so welcome to all of you, and nice to see the sea of maroon in the room again. Good to always have you here. President Cunningham, I appreciate that you're here and you've taken on a mantle that's a very difficult one, and so many interests that come around at this kind of effort here. And so clearly this is the beginning. There's an empty chair there where Fairview could be sitting. I don't know why they're in it, not in that chair, and maybe they would come up and tell us what they think about this as a partnership. Maybe they're not ready for that, but I think that's interesting to me. But I've always hoped that the U could be what it could be. As the father of 6 sons, you hope they could be what they can be and rise to their helping serve the world in their own way. And I think the U has an opportunity to lead in Minnesota, but I don't think they have totally ascended to that level. They have an amazing alumni base of many retirees who have graduated from there, doctors and all kinds of professionals who would love to continue to guide you along the way for free. Buy them lunch, they would go. I talked about that, and so I hope that as this goes forward that you avail yourself of some of that help. I don't think you have to be in a room just with a few of you, but I think that as you assemble the greatness that the U has helped to train and to get to their own level of success, they can feed that back into their alma mater, and in so doing, help the state. So I wish you well in this. A lot of concerns that probably you've already thought of, but I'll just list two, and you can react to them or not. If you have been paying attention, I was complaining about Alina closing pediatric beds, leaving none in the North Metro with this consolidations. Consolidations, in my opinion, often reduce services in the name of money, and so people are left without services. And so as you go forward more with your proposal, I'm interested to see how you're going to retain services in these little towns up in greater Minnesota so that we don't go with the Foston story that Essentia did, and even the Mayo closed Albert Lee's OB thing. And so there's people living out there. There's not room for them all here, and they want to enjoy the greater life in greater Minnesota. So hopefully as you go forward, you can assure us that you're going to retain those essential services and that you're going to find a way to interact with labor, which can be rocky, and I totally get it. But they're key partners as well. And so my encouragement to you is to bring them to your table ahead of time, and I'll look forward to the U. And so the thing is, the U has this North Star thing. They could be the leader in America, but certainly in Minnesota for how we do healthcare as we innovate and all of that. And so I challenge you to that, I guess, in a friendly way. But it's not like you're alone. I mean, you have the head for this, you've got a career, and you've got the experts of all around you, next to you specifically, but in the room. And this could simply be amazing. So I cheer you on with that. So thank you, Madam Chair.
Thank you, Senator Abler. Dr. Cunningham?
Yeah, thank you, Senator Abler. First of all, for cheering us on, and I share your aspiration for how we collectively can advance the University of Minnesota to serve everyone across the state in both for health, but to really be those great children that you mentioned, the great sons, to really achieve all of the full potential of the university, and certainly the full potential for health. And those are certainly our goals as I come in, really taking a fresh look at your climate here in Minnesota and see the tremendous work that's been done here already with health and how we can advance that even better. I would address a few of your questions and then also ask my colleague here to answer some more. So first of all, I certainly have not been doing this alone over the past 8 months. I have really enjoyed being in every corner of Minnesota, from Farm Fest across the northern parts of Minnesota already and up to Duluth and Crookston several times, and talking to everybody and everywhere in between. My staff is rather exhausted with my schedule of really trying to meet people on the ground everywhere. And what I hear from my early days in May when I started coming here, certainly there is a component of health with this challenge upon us, but also how health is important to every Minnesotan and how the economies across all of rural and northern Minnesota depend. In order to have strong economies, you have to have access to local health care and high-level quality health care, and how the university can be part of those solutions. And this is one part of that solution, and then we have some other parts of the solution in our later proposal today. But we indeed have been on the ground, and we have been talking to our alumni and listening throughout the state, and I continue to enjoy those conversations and learn an awful lot from them. The second part is, I'll speak a little bit on the labor side. We have, continued always to be working, to be meeting with our labor and our unions around what we know and what we don't know and what the possibilities are. And, what I would say here, one of the exciting parts about this potential vision together is it's really the least disruptive option. It's minimally disruptive to all of our employees, including our labor employees, because what we're looking at proposing here is taking the things that exist and building on them together as opposed to trying to pull them apart. Do you want to speak a little bit about this certainly is not consolidation, so I'll let Dr. Herman speak about that.
Dr. Herman.
Yeah, Madam Chair, Senator Abler, thank you for asking that question about consolidation. This is certainly not about consolidation. We have the privilege of caring for people in rural areas that face distances, particularly this time of the year, that really impede their access to care. One of the primary drivers of consolidation, particularly in rural areas, is the lack of workforce to support the care in the local communities. The design behind this broad proposal that we're moving forward right now is to say, number one, how can we create the healthcare workforce of the future? And then how can we best employ that healthcare workforce of the future to make sure that people can get their care close to home? We provide a significant amount of specialty care and primary care through telehealth. Many of the patients that we serve right now need to come down to the Twin Cities for some of the care that they get. What we're envisioning with this is that how do we build that so either the physicians go to the patient, the caregivers go to the patient, or through technology we can provide that care close to home. In rural Minnesota, we have more of our population is older than the age of 65 than you'll find in metro areas. That provides several different challenges. Naturally, they have more illness, a higher burden of illness, more barriers to transportation. How do we help those people age close to home so they can continue to live in the rural communities that you spoke so eloquently about? So this is not a consolidation. It's designed to try to prevent that consolidation.
Senator Abler, any comments?
Well, thanks. I could talk all day, but I won't. Thank you. I appreciate that. There's many more conversations to have, and I appreciate the answers you can give, and I wish you the best.
Okay. Senator Port.
Thank you, Madam Chair. To sort of not belabor the point that Senator Abler was making, but like, what do you have specific plans for places where clinics are very close to each other, where there's a Fairview clinic very close to an Essentia clinic? I know that we talk about coming together, but that hasn't worked out that well in the past for Greater Minnesota. When healthcare has talked about that, it's generally meant consolidation, even if not at the beginning. Like the Grand Rapids and the Deer River clinics are 17 minutes apart between Essentia and a Fairview clinic. Is your intention to keep those both open? Are you talking about bringing them together? Can you talk a little bit about where that overlap is?
Sure.
Dr. Herman?
Madam Chair and Senator Port, both those facilities are very busy right now, and there is no good reason to bring them together. The power of this, though, if you could bring them together clinically, it provides that integrated care between them. So one of the things we've talked about on the range, having multiple independent providers there, both Fairview and Essentia are there. How can we partner better together for things like behavioral health and mental health, and how do we really gain that necessary volume of patients together to be able to do that? You also have to think, when you think of Deer River, there's a big gap to the west of Deer River. So people aren't generally traveling between Hibbing and Grand Rapids and Deer River. There's 70 miles between the clinic and hospital that we have in Deer River and the next hospital, which is Bemidji to the west. So when we look at that, we look at very much from a consolidated geographic area, not in consolidation of facilities, but how do you bring the care closer together so the patients don't fall through the cracks?
Senator Port, any further questions?
I'll hold for now.
Okay. Senator Utke.
Thank you, Madam Chair, and thank you to both of you this morning. Ever since the announcement here a while back, it was of interest because, of course, in Park Rapids, we have 2 Essentia properties. Mm-hmm. And when we talk about possible consolidations, just in the last 3-4 years, you actually built out the second facility. So in a town of 4,200, they're not only just maintaining, they're expanding and doing a wonderful job across a big share of northern Minnesota. So we thank you for that. And really, I just, after hearing the announcement and being kind of in the heart of Essentia up there, I'm just looking forward to future information, and as you can share how this is moving forward, and looking forward to the partnership. So thank you for joining us this morning.
Thank you.
I guess there wasn't a question in there, but any comment?
No.
Thank you.
No.
Senator Bolden.
Thank you, Madam Chair, and thank you for being before us this morning. I have a couple of topics I want to ask about. The first is just wondering how, if at all, you all have engaged labor partners in discussions about the proposed new system, and from your view, what role do you see labor partners having, and planning as you move forward?
Dr.
You can start.
Okay.
Dr. Herman?
Yes. Madam Chair, Senator Bolden, thank you very much for that question. Our labor partners are our colleagues, and we work shoulder to shoulder and side by side with them each and every day. I have the pleasure of interacting with them on a daily basis. We pride ourselves at Essentia communicating with our employees. We have an all-colleague update that I lead twice a month. We've talked about this there. We work through those conversations. What I've heard from my labor colleagues is some of the questions that were asked here today. Is this a consolidation? Are people going to lose their jobs? The answer to that is no. Are we willing to honor all labor contracts? And the answer to that is yes. During my tenure at Essentia Health, although we've gone through quite a time of expansion, we have always honored labor contracts. And even before my time, I'm unaware of a time when we ever did not do that. So we're looking forward to preserving jobs. Are the people that we're privileged to serve need more health care rather than less health care, but they need it delivered in a better, more cost-affordable fashion.
And I would add, our HR and labor relations folks have also been, over the last 6 months, but certainly over the last month, keeping our in good conversation across our labor groups for what we know and what we don't know, and obviously they're critical partners in this. And, I would just emphasize again, this is not a consolidation. And as I view, again, coming in fresh to the state, how can we try to devise a path forward that is a positive path across these organizations, that is one that builds on the good work that labor organizations and employees have done and is financially sustainable and would support those labor and employees going forward. As I look at the myriad of options that have been, this is the one that would be most likely to be able to preserve a financially stable, supportive path for our employees going forward that would be minimally disruptive, and which excites me.
Senator Bolden?
Thank you for that response. I appreciate that. And I have one more question. I'm going to switch gears here. It is timely that we have you before us. We saw last Friday evening the Trump administration through a letter that the National Institute of Health will dramatically cut funding for scientific research. And so, and we heard the university's website states that it had received a handful of individual project stop work orders. And some federal agencies have removed access to certain funding opportunities. So I'm wondering if you can say a little bit about that. How many clinical research projects and jobs are impacted by those changes? And do you have can you share information with us about loss of funding that is happening now related to research that is happening at the university?
Sure, and
Dr. Cunningham.
Thank you, Chair. And Senator Bolden for that question. It is timely. There are a myriad of things facing a university president these days, I might add. So, but a lot of these do tie to health. So, there's really sort of two parts to your question there, and I'll try to take them separately. The Friday night order on the change of indirect funds from the executive order would directly impact the university and the nation's biomedical enterprise. And, the reason I want to be clear, the reason I will speak loudly about that impact is nothing to do with partisan or political components. As a physician, as I took care of patients, I never had a patient talk to me about their political party when they were asking whether I had a life-saving cure for their cancer or a medical treatment for them available. And those life-saving cures and medical treatments are available to them because of the work overwhelmingly done by the biomedical research funded by the NIH. And also as the steward of your university, we have, 3 missions: education, research, and service. And that directive on Friday night would have gone directly to the heart of 2 of them. So in rough numbers, what that order on Friday night would have done approximately would have immediately cut out $130 million to the university's budget, and that is money that is, and that what that would mean would mean a direct cut to all of our ability to do research. And that research is what drives a lot of the medical innovations, including our wonderful med tech economy that we have here, and would directly impact our ability to provide that sort of life-saving bone marrow transplant, cancer, child's health work that is done at the university. There's no doubt that would impact a multitude of jobs for $130 million. The other thing it would do that it's important for people to note, which is again why in a way that is 100% not political, I speak out about it as a university president, is we also train over 10,000 graduate students. Those graduate students train on research projects with research mentors that get their facilities and their funding by the kind of work that the NIH is funding, and it would absolutely devastate our ability to train the next generation of scientists for the country. So that's what those impacts are. I think in terms of stop work orders, that was the weeks before directive, and with the question of a pause on federal funding. Although that pause on federal funding to universities, with those riders on it, has been halted for now. Individual agencies are providing our faculty stop work orders on particular grants. We're compiling the list of the extent of that, but that is going on, and we are, in the meantime, working out whether we indeed need to pause them or don't need to pause them, and are trying to assess that information. But I do know our faculty have received those, and our administration is working to assess that and working with our council and really with our national partners to understand what we need to do next. Thank you for the question.
Senator Bolden?
Thank you. I have many more questions, but I will stop there for now. I appreciate that, and appreciate the emphasis on the really amazing and important work that research means for our communities, for our state, for the health of Minnesotans. And as you learn more, and as you're compiling information and sort of gathering, what this means and what is stopped and what is not, would certainly want to be in touch about, as you learn more information. So thank you.
Thank you.
Senator Udke, did you have a question related to this question, or okay, Senator Udke.
Thank you, Madam Chair, and for Dr. Cunningham. As I see what's going on, it hasn't cut any money for research, correct? Everything I see is just telling the institutions that more money needs to be spent in the actual research rather than administration and facilities. Is that what you're seeing on your end, or could you enlighten us on that? Because I saw it that 80 to 85% was supposed to go to salaries and the research side, and only a smaller amount to the administration and the overhead, facilities, et cetera. And if you could clarify that, if it's different than what I'm reading.
Dr. Cunningham?
Madam Chair and Senator, thank you for the question. This is a confusing topic across the country, but the cuts that we received would directly impact the research. So there's no way to untangle that a cut from our negotiated rate with the government of 54% to 15% wouldn't devastate our research enterprise. Grants receive direct funding for salaries and to do the direct research projects. And then since, a post-World War II era, we've also, across the country, received the indirect overhead costs, which are our partnerships. So those researchers actually can't do that work. We wouldn't be able to take the money because there would be no facilities and no information research security around them. There would be no one to do the, it would cut the money that would actually be what is the surround sound of the research. So we wouldn't be able to do the research. And it would be a cut then to the research administration of how we take the grants, of how we administer the grants, of how we maintain security of the data for the grants, and the actual facilities and equipment needed for the grants would be cut. And without the facilities and the equipment needed to do the grants, it doesn't matter if you fund the individual person. there is no way to advance that work. And with that, we wouldn't be able to innovate. And what that will do is we have long enjoyed the privilege across the globe of a competitiveness for biomedical research. And what this would do would eliminate our competitiveness across the country, across all states, regardless of political stripes, for our ability to generate health and biomedical research and work for the country. And certainly if we cut $130 million out of our budget, I promise you that will also impact our students and their tuition, and would also, again, devastate those graduate students trained in those facilities that are built with those dollars, and we would completely hamper our ability to train scientists for the state of Minnesota.
Senator Edke?
Thank you, Madam Chair. And I won't have any more questions for us here today, but I would appreciate if we could follow up offline and have further conversations, because I would like to know more and have some engagement there. So thank you.
Thank you. And Senator and Madam Chair, you know, my last role was also Vice President of Research. And so I'm happy to have many conversations with you about it. I know this is a topic that is, while everyone is looking to cut costs, we have to understand this would be a direct cut to the actual research itself. Thank you.
I have three others who expressed interest in this particular question, so I'm just going to go to them so we have continuity of the discussion. Senator Liskey, and then Senator Abler and Senator Kupek. Senator Liskey.
Thank you, Madam Chair. Madam Chair, Ms. Cunningham, I guess my question starts with whether this is actually a cut or a cap on that money. I understand that you're describing it as a cut, but is it actually a cut or is it actually a cap? And let's start with that.
Dr. Cunningham.
Madam Chair, Senator, it would be an immediate cut of between $100 and $130 million to our budget for next year.
Okay.
Senator Liskey.
Thank you, Madam Chair. Ms. Cunningham, I guess when I'm reading through kind of what's going on, what's happening, my interpretation is basically the government saying that it's no longer interested in subsidizing the research, which it's not saying it's not going to. It's just saying that it's, instead of spending the entire budget, that we're capping it at 15%. And so I guess I'm trying to figure out what the differences are, and why you describe it as a cut, why the federal government's describing it as a cap, and then why we can't. It doesn't say that we can't raise the funds in a private manner using private funds, and it doesn't say that we can't do those things. So I guess I'm trying to figure out where the differences are. I have a feeling it's a very political answer, and so I just wanted to see where the argument is from there.
Madam Chair,
Dr.
Senator, this is not political. This is the fundamental core of how research universities work and how health research is conducted across the country. So you're correct in that it would be a cap on the indirect rate, but the current indirect rate is 54. And so if you capped it at 15, it'd be an immediate cut of the difference between 54 and 15 on hundreds of millions of dollars of federal funds. What we as your research university do is we take federal funds from DC, we bring them to the state of Minnesota, and thereby we generate jobs, we generate research, we generate innovations, which turn into companies and startups and economy here. If we go from 54 to 15, we will have a massive cut to the actual research itself, and that would impact all of those things for the full state of Minnesota. So I think that was your first question, was the cut to the cap. The second one is, could the private industry pick this up? That has not been the way the country has worked for the last 50 years. There is no model by which companies will start funding the university at hundreds of millions of dollars to do this research. And I know it's been mentioned in the press that, you know, private foundations have a lower indirect cap rate. Primarily, those are around, first of all, social science, which don't require very complicated facilities, high-tech equipment and machines, and high-tech security. And they're only able to do that in the private sector because there is this contract with the federal government for this partnership that actually creates the entire enterprise. So without those funds, what I can tell you is research universities across the country would be absolutely devastated in our ability to provide cutting-edge science and technology and competitiveness globally with China and other places will be absolutely devastated. And NSF was also notified that they would be cut yesterday by a number of positions. You know, that will cut things such as the NSF Engines grant, which was recently cut. I mean, that's how the country will be advancing microelectronics and semiconductors. These are key things that we need to do to maintain our global competitiveness. And which is why, as a research university, it's my job to point out to you, this would cut your research university, which would dramatically impact our ability to provide economic impact for the state and train scientists to maintain our national competitiveness. Thank you so much for the question.
Senator Liskey, no. Senator Abler, did you have a question related to this one?
And Madam Chair, I was going to take up this conversation in the next part, but since it's here, I'll just do my little thing now. And then, so I did give the university heads up. I was going to ask about 54%. And anyway, so I think we need to talk about what that is. I was waiting in your comments to Senator Bold and others about how that's just a very fine number and how you make that up. I didn't hear that yet, but maybe you were prepped or you weren't for that. And well, I mean, it's your first time here, so I mean, like, this is a place to be. So we're not trying to be mean to you or anything. And but so there's just at its face, 54% seems like a lot. And there's a memo from the NIH, which my staff found for me. It's like, oh, that's cool. There's facilities categories, which is depreciation on buildings, which is not a cost, really. I mean, we give you bonding money to fix things, and interest on debt, and so on. And it even says, so I was chatting with your staff, and they said, well, it's 30 to 70. But then in this report, it says that on research stuff, not just social research, that a bunch of ones actually have 0, and some of Harvard has 15%, and maybe we're not talking apples to apples. And it says also it's not retroactive, so that's good news. But anyway, so I need to learn a lot more about this, but I'm just I tried to confirm with Jeremy Olson, who wrote an article, it was in the Tribune, and somebody said it was a direct attack. And so you do not want to get involved in the Trump, no Trump, Musk thing. And by virtue of the tone of this article, you are. And so be Switzerland. And every hearing we have, somebody says, oh, Trump did this. Oh, there's fraud. I mean, this is going to be the most difficult session we've ever had for all kinds of reasons. And I'm not minimizing what people are afraid of the Trump or all that. It's going to cause some changes. But in this arena, the has to be this bastion, this, redefining healthcare and moving off of that point into something that's focused on service, like when I began in practice, when you began in practice, and not on money. I tried to make an appointment with a dermatologist yesterday. I was driving, oh, you can't sign up without your insurance card. That's what we've gotten to. Can the U lead the way do bring in more of those alumni. They would actually come for lunch, I asked a few, and point a way to do better than this above all of that. That's my counsel to you, and hope I didn't provoke a whole Trump discussion now, but it's not productive to your mission. And so you can say we're concerned and all that and sharpen your pencil, but you need the whole state to be behind you.
Absolutely.
And every party, and the Green Party, Libertarians, everybody, because the potential that the U has in this area, even to find a way to handle all this stuff, can lead the nation. So that's my encouragement. Thank you.
Before you continue, I think there is a difference between understanding how that 54% is determined, because I think that over time there are opportunities for discussion of how that is actually determined for each institution. And my understanding is that it varies across the institutions. What I heard from Harvard was like 70% as their indirect rate. And then some institutions have a very low rate. And as you mentioned, some projects don't require the equipment and the indirect costs that others do. So I don't know, maybe you can comment on that process that has been going on over decades to negotiate that indirect rate. And then I think there's a process that is followed that isn't being followed here, and a severe change in that process is going to have a very negative effect. So, Dr. Cunningham.
Yeah, thank you, Madam Chair, and thank you so much, Senator, for your questions and for your counsel. I really want to say, first of all, if people look at the statement that I wrote, it certainly did not mention any administration, at all. My comments are meant to be fully nonpartisan and speaking for what the impact would be for our research university. And what that would mean for biomedical research across the country. And we are Switzerland, and I am here to serve the whole state and all the citizens of the state, regardless of anybody's political views. We have a mission to accomplish, and that mission is to the people of Minnesota. So please hear that very, very loudly. Health is core to the people of Minnesota, and cuts to biomedical research, regardless of who those came from, would impact the health of the people of Minnesota, and that's the voice from which I speak. A couple of comments. We have a negotiated rate of 54% at the university for NIH funds. That is a negotiated rate that's done. We negotiate that rate with the federal government about every 3 years. We actually have the lowest negotiated rate across the Big Ten. All of our peers have substantially higher negotiated rates. Our private institutions, as you mentioned, Harvard, receive quite a bit more than we do. So we are actually already doing a tremendous amount of research with some of the lowest actually compensation for our overhead rates for our facilities and the infrastructure and equipment that we have across any of our peers. I cannot tell you how efficient your university is here in the state of Minnesota, coming from the outside. So I think you should all be very proud of the amazing work we do on efficiency here. So the funds that come in, again, are used directly to build buildings, to pay for the debt on the buildings that we, put forward money to spend to build. Sometimes we get money from the state. I look forward to that this year on bonding, potentially. They go towards equipment, new state-of-the-art equipment, should it be the fanciest MRI machine or the fanciest lab tech thing? Individual grants, the direct rates, as the senator mentioned over there, that fund researchers don't fund that. So the researcher actually can't do the work on the state-of-the-art work unless the overhead money comes in to pay for that equipment and for the building that they literally need to sit in, the lights that are paid for. So actually taxpayer dollars those overhead rates are helping to pay for, the lights and the utility and the buildings that research happens in. This is an amazing way in which the university brings in federal dollars to the state of Minnesota for the betterment of the citizens of Minnesota. And I'd be happy to talk to you about it more offline. Thanks so much.
Senator Port, did you have a comment or question related to this topic?
Just really quickly, thank you for clearly your vast knowledge on this subject. We are going to need your partnership in this as we move forward, because you're right, it doesn't matter who made the cuts. It matters that the cuts are being made and what they mean to people, both your researchers and grad students, and the tremendous reputation that you've built as a state-of-the-art medical research university, which is critical to the economy, as you were talking about, but is also critical to people's health. There are many clinical trials going on right now that will likely stop if these cuts go through across the country. I have long COVID. There's not a cure. There's not a great treatment. Many clinical studies are happening right now, which are likely to just end if these cuts go through, without getting through to that final research. I am carrying bills in this committee for Senator Dietzich, continuing advancement of cancer treatment, because that is one of the core things that universities like yours do to continue to help advance those things. So I understand being Switzerland in the political sense, but also we need you, we need your fight. We want to fight with you because the work you're doing is absolutely critical. And there's not a private sector place that will pick it up and do it because it is not on its face financially profitable. You have to do the research that gets us to the point where there can be a treatment that is, then used to make money off of people. But you do the research that doesn't make that profit, but gets us to the treatment. And that is a critical space that in our capitalist economy, no one else is going to pick up and do if we don't fund it. So thank you very much for answering these questions today. I'm certain this will be the first of many conversations, but it does matter that these cuts are being made, and we need to continue to talk about the importance of the work that's being done there.
Any comment, Dr. Cunningham?
Thank you for your comments.
Senator Mann.
Thank you, Madam Chair. Thank you, Drs. Cunningham and Dr. Herman, for being here today. You're doing really hard work at a really difficult time, so thank you. I also really appreciate the work that the U of M does that benefits every single person in the state of Minnesota, and your work is absolutely not political at all. And I also think it's kind of silly for us on this side to be told that we can't say the administration's name and we can't say Trump when we talk about these things. Because we are sitting here for the first time in our history having this conversation because of the Trump administration. And as our educational institutions are being decimated across the country, we have to start saying things out loud. So just on that topic. But I want to switch gears a little bit. I want to talk about the education piece for our residents and our medical students. It says here on the Essentia overview that you have several Catholic facilities. This is particularly concerning to me when I think about Catholic institutions and medical training, because I did part of my medical training in a Catholic institution, and while my training was wonderful for the most part, it really was lacking when it came to reproductive health care. And in fact, we did some things that were not standard of care that really I think about to this day. So specifically, when I look at the ethical and religious directives on the Essentia webpage, and directive number 45 that says that abortion is never permitted, that in and of itself is concerning to me because the word never should very rarely be used in a healthcare setting because every patient is different. But then directive number 48, which says that essentially even in the event of an ectopic pregnancy, abortions are not allowed. So to just very briefly explain, we're talking about a non-viable pregnancy because babies cannot develop inside of a fallopian tube. So this baby will not live. But what can happen and does happen is that fallopian tube ruptures and the mother dies. So we're saying that we will risk the death of a pregnant woman because we don't want to do the standard of care, even when that baby is non-viable. So, this constant theme of the moment someone becomes pregnant, their life no longer matters, not the standard of care, not something we should be teaching at our educational institutions. So my question is, if there is a joining of these organizations, who will decide what we teach our residents and our medical students? Because I want to be sure that we continue teaching scientific standards of care and scientific evidence-based medicine. So how will that conflict with the Catholic institutions at Essentia?
Dr. Herman?
Yep.
Please go.
Madam Chair and Senator Mann, thank you very much for that question, because I believe there needs to be some clarity on that. First of all, we do emergency terminations of pregnancy to save the lives of the mother. We would never sacrifice the life of a mother for an unviable pregnancy. We don't do that, and we have never done that. We are not a Catholic health system. We are a secular health system with Catholic facilities. We do a significant amount of training right now for the University of Minnesota. We would continue in our Catholic facilities to follow the ERDs without sacrificing the life of a mother, we make a different distinction. In our parlance, an abortion is an elective procedure. An emergency termination of a pregnancy to save the life of a mother is something different and something that we do, unfortunately, when it needs to be done. The second part of that is that although we would allow our Catholic facilities to maintain their Catholicity and their current adherence to the ERDs, we would neither expect nor require the rest of the facilities across the system to do that. As a matter of fact, there are facilities at Essentia Health, within Essentia Health right now, that are non-Catholic facilities and follow only 3 specific ERDs. And those 3 specific ERDs is no voluntary termination of pregnancy, no euthanasia, and no assisted suicide. 2 of those of which are not legal in the state anyway. But I will tell you this, is that the sisters that I work with side by side are strong advocates for women and would never allow us to sacrifice a woman's life for an unviable pregnancy.
Dr. Cunningham?
May I comment? Madam Chair and Senator, I really appreciate your question, and I can't tell you how committed I am to the full range of reproductive training and reproductive rights of women and the full ability of our physicians to provide best standard of care in our training and to train the future generation in the same regard. So this combination that we're talking about coming together, our physicians would continue to be trained with best practices, and in the way that we're considering this system all across the except for the small facilities that Dr. Herman discussed, would have full access to would not be limited by the ERDs that are being suggested there. And I guess I can give an example, and I know you're trained as an emergency physician, and so am I, is in my original training in my residency, we had multiple clinical sites, and in one clinical site was the academic major facility. The other was a Catholic hospital across town. And in that Catholic hospital across town, when I was in my training there, in that particular place, I saw how they did things, but I got my full scope of training of care for all the rest of the things I needed to be a good physician going forward and to be able to practice wherever I chose after that, and have all of that knowledge was given to us across the rest of the system. And I know our obstetrical colleagues at the University of Minnesota are passionate about this, and I want to assure them and you that we would absolutely not accept any ERDs or limitations on reproductive care or care for women in health within our training facilities. Yeah.
Senator Mann?
Thank you, that's wonderful to hear. I just might make a suggestion then that you take a look at Directive Number 45 and get rid of it, since that's not the way that you're practicing medicine.
But
Dr. Herman?
Yeah, thank you, Senator Wickland and Senator Mann. It's not my purview to remove the ERDs. That's done by the Catholic Church. What's in our purview is how we affect those ERDs within our facilities.
Senator Mann, any other? No? Senator Port, did you have a comment?
Thank you. I think to this same line of question, there's also one that says IVF is not allowable and one that says contraception is not allowable. And I'm also wondering about gender-affirming care, if that's something that is provided in your clinics, and if it's not, if that's something that the University of Minnesota system will continue to provide, and what that would look like.
Dr. Herman?
Yeah, Madam Chair, Senator Port, thank you very much for that question. We do provide gender-affirming care at facilities at Essentia Health, with anything that's within our scope of our expertise to be able to do so. We believe that it's part of the dignity of the patient, as I mentioned before.
Senator Port?
And IVF and contraception?
Contraception as well. We do
Dr.
not
Herman?
have the capability to do IVF. We refer patients for that.
And
Senator Hoffman?
Thank you for doing this. It seems like last year, I just want to know, when you had this conversation last year, you know, you had Governor Dayton and Governor Pawlenty in the same room. I mean, they're not here today. What happened? Did they get the VIP access there, Senator? But I'm glad you guys are here and having a conversation, and I'm glad that you value your relationship with labor. You say there are colleagues, there are partners. And I'm glad that Senator Abler brought it up, and I'm glad that our good senator from Rochester brought that up as well. Because I'm sitting here saying, help me understand. You had a 49 days SEIU issue. January of this year, the National Labor Review Board told you guys to acknowledge APPs and do that, and yet there's been crickets on that. And I don't want to get into a negotiation discussion with you, but when you say you value something one way and that yet the optics are publicly you're not doing that, it kind of makes somebody say, help me understand. And so if you're going forward on this, you want the trust of the community. Maybe that help me understand piece needs to be something that looks at, just like what Senator Mann had issued about, the optics on that. So I appreciate you coming here. It's more of a statement to you versus anything else, that I'm having a hard time looking at this so-called collegial relationship when I know, in fact, that there are people that have been waiting for you to do the right thing on behalf of labor. And so I'm just perplexed by that. So that's it.
Dr. Herman, did you?
Madam Chair, Senator Hoffman, thank you very much for that question. I will address both of those, if I may. First of all, with our SEIU colleagues in Deer River, we were a long ways apart. Their first thing was a 70% raise over the next 3 years. Our revenues are actually cut in rural health systems. We cannot afford to provide a 70% raise. We're very sorry that they went on strike. When the regional group came in and sat down, we were very able to come to a deal very, very quickly. And we're very, very proud of that. We value those colleagues. From the APP standpoint, there is a thing called the healthcare rule that says that a bargaining unit can't be so large as to affect the access to healthcare in any particular community. What the regional NLRB did with their ruling on that is they suspended the healthcare rule for the APPs within our facilities across the East Market. We do not believe that that is legal. We have made an appeal, which we did right away to the NLRB, and we're waiting to hear back from the NLRB to see if our appeal is successful or not. During that time, while that appeal is pending, we cannot negotiate with our APPs because with an appeal pending, by definition, we cannot negotiate in good faith. So we're looking to hear back from the NLRB, and when we hear back from the NLRB, we will take a look at our options at that particular point in time, but we're hopeful that we can sit down and across the table from our APPs as soon as we hear back.
Senator Hoffman?
So, Madam Chair, that just goes to say, that we're explaining why we're not able to do things, but the optics, the public optics are not what he explained. So I don't know how you get that explanation to the rest of the world, how you just did that. I appreciate you doing that. And knowing what you said, colleagues are side by side on a daily basis. We honor our labor contracts. Labor is our partners. You said that. Now, hopefully you can keep that up and keep going. So I appreciate you responding back. No need to, but you did anyway, and I acknowledge that. So thank you.
Thank you. Senator Kupek.
Thank you, Madam Chair. In full transparency, I feel like I'm really late. I'm behind on every single one of these conversations. So I'm gonna do that. I'll have a comment, a softball question, and then a harder question. So here's my full transparency. So first comment on, as a state, in terms of how we have given money to higher education, and as a national government, we have drastically cut the amount of money that we have given to higher education as a percentage. And so institutions are forced things like these research dollars to try to find slightly other ways to keep the lights on in all the buildings and do those things. So some of that is a little bit on us in the way we funded education. So that's my comment. So my softball question will sort of be, so Dr. Herman, I know we've had discussions. We have Essentia Hospital in Detroit Lakes, and we've talked, some of that about workforce shortage. And I think the footprint of the University of Minnesota Medical School in Western Minnesota is a little bit lighter. We have a lot of University of North Dakota doctors, I think, up our way. So how, in the complete self-interest, how does this benefit people in my district, Detroit Lakes clinics that you have in Moorhead, and even, you know, the hospital over in Fargo, which my constituents utilize.
Dr. Herman?
Madam Chair, Senator Kupek, thank you for the softball question. What I will say is we know one thing for sure when we train medical students and when we train residents. Where they train is where they will practice. So expanding the training opportunities through the University of Minnesota in these communities allows people to see the advantages of living in those communities. Interestingly, I grew up in International Falls. I ended up training down in Rochester. I ended up practicing down in Rochester. That's where you establish your community as you're training. It makes it very attractive to stay. So as we can expand our training to these rural areas, as an example, we have 8 family medicine residents in Duluth each year. They graduate each year. 5 of them stayed in Duluth and the surrounding area. So we know that that is how that works. Thank you for the question.
Dr. Cunningham?
Madam Chair and Senator, if I may add here as well, you know, when we talk about, as Dr. Herman mentioned, training people where they will live and work is important, really important community. And, you know, the university is bringing to you a number of solutions in that regard. We are looking to expand our medical education footprint in St. Cloud. We are looking to expand that footprint in Duluth. But what I have to also have you know is the medical school is at an existential crisis point right now, however, for our stability, right? I mean, we have a contract that is not renewed. We have to find a path to stabilize our medical school, and this potential solution does that. And with it, we're bringing to you, you know, $1 billion. We have $1 billion problem. And we're bringing to you $1 billion solution that does not cost the taxpayers money. If we don't move ahead with this solution, we still have $1 billion problem that, you know, we would have to have more conversations for how state partnership would then help us continue our management and training of these physicians going forward. And the work that we really want to do and expand, and we have great partnerships and continue those with, you know, with CentraCare and Health Partners, and we do a lot of clinical training at other sites, and we can continue to expand that, you know, St. Cloud and more medical education there. But if we can't find a path forward here successfully, I have to stabilize the core. We won't be in a position to do partnerships, to do training that would get you the workforce you need across the western part of the state. So we have to stabilize this, and this path forward we think is an exciting vision to do that. Thank you so much.
Senator Kupek.
Okay, and then I have one maybe slightly harder question. Don't know if you'll have an answer for this. So, and I remember actually it was 2 years ago we sat here with the other governors and talked to them when Sanford was in talks with the merger with Fairview. And one of the things, you know, that was concerning of that was that that Fairview felt like they needed to merge with Sanford was that Fairview had a fair amount of debt. So how does this collaboration with Essentia, how does that interact with that debt that the Fairview system has, which is pretty substantial, if I remember, from 2 years ago?
Dr. Cunningham, or Dr. Herman?
I'll start.
Okay.
Although I'm not Madam Chair and Senator Quebec, thank you very much. Although I'm not familiar with the intimate details of that, the challenge of any healthcare system is that every healthcare system runs on debt. You use your balance sheet to borrow money to build a hospital. As things become challenged from a revenue standpoint or from a margin standpoint, it doesn't allow you to invest in the facilities and other investments and people that you would make. Bringing this to the table is an opportunity to address the shortfalls in investment for facilities, investment in developing the people. That money comes from a strong balance sheet and the ability and the willingness to use that balance sheet to borrow other funds. Through that, you also need to have an efficient medical practice that provides the revenues but first of all provides the great care that generates those revenues to support those debt payments as they come forward.
Dr. Cunningham.
And if I may, Madam Chair and Senator, you know, to speak to the, we have seen that there has been a undercapitalization in the facilities for which we do our training. Again, without discussing the intimate details of what those balance sheets are, what this solution would do would be bringing, both through the balance sheet of the university as well as Essentia, be bringing a solution to that, which would then recapitalize the buildings and recapitalize the system, all across the state. And I think, you mentioned the prior deal on the table, and, I want to just speak. I came in again as a newcomer to your state. I heard a lot about this potential deal on the table last year and what its potential pluses and minuses were, and I just want to give a shout out. In some ways, there were some, as with any idea that succeeds or fails, there were some kernels of very good ideas there, a kernel of the ideas which we've tried to move forward. And with that, I, congratulate in some ways, our Fairview colleagues in the past for the kernels of those ideas, although we think we're building on those ideas now. And those kernels were bringing a system together that's larger, that has the scale to actually support academic health in a broader way. That was a kernel of idea that was part of that Sanford that also is part of this. Here we're doing it with an in-state, Minnesota trusted healthcare system. So that's something else that's coming together. The other part of the kernel of that idea that was good before was recapitalizing the system. On the public record for that was that that deal would have brought $500 million to recapitalize the system. Here we're talking about $1 billion to recapitalize the system. So again, building on what were kernels of good ideas, addressing the challenges that I heard within the state when I came in for why that didn't move forward, and trying to parlay that into something that then is a solution, going forward. And many people across the systems thought there were merits to that idea and were willing to look into them into a lot of depth. And what we're looking to do here is to have that same deep evaluation of this concept for what we think builds on the good ideas and good intentions of people at that time towards what we think is a better solution for Minnesota going forward.
Dr. Herman?
Madam Chair and Senator Kubek, if I could also expand, these investments in people and in facilities would not just be in the metro area. We would look at the best use of that capital. I know that we're talking right now that there are some needs in Detroit Lakes that we're looking to solve there. So this is an all Minnesota solution, not a metro solution.
Senator Kubek? Senator Bolden, did you have a follow-up?
Thank you, Madam Chair. I just have a short follow-up. I wasn't planning on speaking again, but something, your conversation with Senator Hoffman sparked a question for me in relation to your interaction with the APPs and waiting for, a response from your appeal with the NLRB. Sparked for me, I'm looking at a CBS News article from 2 days ago talking about the NLRB is not operational right now because, I'm not looking for a political answer from you, but the reality is the Trump administration illegally fired one of the members of this five-member board, and the Supreme Court says they cannot operate without 3 members, so they currently have 2 members. So I'm just wondering, have you received any guidance or heard anything about, will you just be waiting indefinitely as this board is not operational, or have you heard anything of what to expect about that since this board is not functional right now?
Dr. Herman.
Madam Chair and Senator Bolden, we are as eager to receive an answer, I think, as everyone else is. I have not heard anything from Washington as to what the plans are for the NLRB.
I think we will, I think everybody had a chance to ask questions. I really appreciate the generosity of your time in discussing this particular aspect of the University and Essentia proposal. As we go forward, if there are more questions, we will certainly bring them your way. And if you have updates that you'd like to provide to us, I'd certainly look forward to that. I think it is just so important that we move forward with something that is transformational. We know that Minnesotans are not able to access the care they need, and they aren't, and that's due to provider pipeline as well as other issues with costs. And I think that this solution it seems like a promising way to be able to expand access and address that, as well as addressing just the translation of of what the university is really good at into Minnesota to benefit all Minnesotans. So thank you very much for your time today. And we'll move on now to the University of Minnesota's strategic plan and legislative request. Thank you. Thank you. And I don't know if you have folks who want to join at the table for your presentation. It looks like we have 4 people on the agenda, and I don't know if they want to come up and sit at the table with you, or if you want to have them come up each individually, Dr. Cunningham. And just to say that, part of the Academic Health Center Task Force, one of the recommendations that came out of that, as 100% support from all of the members of the task force, was to have a shared health sciences strategic plan. And so I'm excited to see that the work that you've done over the past year since that came out, to bring forward kind of your initial thoughts about a strategic plan. So please, Dr. Cunningham.
Thank you, Madam Chair, and I'll start off, and then I will hand over to my team here. And I want to thank also all the people that did the hard work on that task force, because as I come in to here to serve into the state, it really helped me understand the views of the state and what was some of the needs were. So I do appreciate that. So Madam Chair and members of the committee, thank you again for the opportunity to continue this discussion as I transition now into our legislative request. When it came time for the university to develop our state budget proposals, our intention were clear: to build a brighter future for Minnesota by improving the health, safety, and prosperity of people and communities. As Minnesota's only public research institution, it is our strong commitment and #1 responsibility to prioritize all Minnesotans. Today, my colleagues and I will walk you through some of the key elements of our state budget proposal that focuses on health sciences. As I mentioned before, we are at an inflection point, and our full array of health sciences are critical to the solutions for that. Minnesota's healthcare needs are rapidly changing, shaped by, again, our aging population, strained health systems, and the widening gaps in access to vital services. People continue to look to the university, and we continue to be willing to rise to that challenge. Thank you very much, Senator, to create a healthier Minnesota and a healthier planet. This request was a $45 million state investment, and with those funds, the university would help solve a growing healthcare crisis in rural, tribal, and underserved communities across Minnesota. With this request, we will expand access to care and reduce staffing shortages, increasing the state's workforce by over 3,000 health professionals in the next decade, and then every decade after that. We will support clinical placements for our students in rural, tribal, and other underserved communities, and we'll triple the amount of mobile health and telehealth services by working with local providers and serving more than 6,000 patients a year that need that access to care, for which the distance makes it problematic. A healthier Minnesota and a healthier world is not only possible, it is our duty. Why do we need your investment in our work? The state investment in the academic health is certainly not just about education, and here I'll separate from the other proposal that I bring forth to you, which is us bringing that $1 billion solution. This, on the educational component, is really about a state investment in academic health. It's about ensuring healthier communities, strengthening the workforce, and fostering the medical education that saves lives. With your partnership, we can expand access, reduce inequities, and transform healthcare for the future. And before I transition to my team, I'll also just say that the health sciences are also inextricably linked to the health of our clinical care delivery system in our medical school. And so stabilizing that, as I talked to you about this before, is also critical for our ability to deliver on these advances for workforce for the state. So now I would like to turn it over to my colleagues who could provide more details about the university's legislative budget request for health. Thank you so much.
Thank you. First, I have Dr. Connie Delaney. That'd be great, yeah, if you all three could join at the table. And I have it in this order: Connie Delaney, and then Dr. Mays, and Dr. Pettigrew. Good morning and welcome to the committee, and please go ahead and state your name for the record and begin.
Yes. Chair Wickland and members of the committee, for the record, my name is Connie Delaney, and I have the privilege of serving as the Dean of the School of Nursing. It is my pleasure to join my colleagues to share with you our health sciences strategic plan. It includes and responds also to President Cunningham's budget request, legislative request, and she just briefly previewed that. This strategic plan is designed to build on and respond to the work of our governor's task force on academic health at the University of Minnesota. I had the honor of serving alongside Senator Wickland in that endeavor. The vision of this strategic plan is for Minnesota to lead the nation as the healthiest state. Our mission is to foster a healthier Minnesota, as has been summarized, through education, accessible care, innovation, and partnerships. We're dedicated to collaborating with the state of Minnesota, health systems, and communities across the state. And that dedication is to ensure everyone has access to top quality health care. The University of Minnesota is unique. It has the range of our health sciences schools and programs spanning Twin Cities, Duluth, Rochester, and soon St. Cloud. And we work not only integrally with each other, we work with other disciplines. Some of those are science, engineering, public affairs, business, and agriculture. And we do this to fulfill our shared mission. Moreover, we are one of 4 universities in the United States that is home to all 6 of our health sciences schools: medicine, nursing, pharmacy, dentistry, public health, and veterinary medicine. So you see, this uniquely empowers our state to lead in the health of the people, including individuals, families, communities, and our public, and the intersection with animals. Our graduates understand the connections between physical and mental health. They understand the connections between human and animal health, and between the health of the people and our planet. By leveraging our interdisciplinary and interprofessional approach, we aim to provide the best possible experience for all our students and the highest quality care for Minnesota. Our shared goal is to ensure that all Minnesotans have access to exceptional health care. As you've heard, we propose to achieve this by 4 objectives: expanding access by reducing health workforce shortages statewide, reducing health inequities by expanding partnerships to reach rural and underserved communities, improving healthcare quality close to home, and 4th, transforming health outcomes through innovation in prevention, treatment, and care models. So, Madam Chair, with your permission, I would now like to hand this over to my colleague, Keith Mays.
Welcome to the committee, Mr. Mays and Dr. Mays, and please go ahead and state your name for the record and begin.
Thank you. And Madam Chair, for the record, I am Keith Mays, Dean of the School of Dentistry at the University of Minnesota. So how can we accomplish what Dean Delaney just shared with you? By placing the health of Minnesotans at the center of what we do. This is what we have dedicated our professional lives to healthcare, and moreover to excellence in healthcare. As mentioned, the legislative request that the university is putting forward is for $45 million recurring. But let's take a closer look at how that funding is broken down. It's broken down by objectives. Objective 1 was to expand access by reducing health workforce shortage statewide, a $22 million ask. As you may know, the University of Minnesota graduates approximately 70% of most health professionals in Minnesota. Yet our state and the nation are both facing a critical shortage of healthcare providers. As educators of approximately 70% of Minnesota's health workforce, the university plays a unique role in training the next generation of healthcare professionals. Over the next decade, an investment in this request will result in an increase in healthcare workforce by 240 doctors, 200 veterinarians, 650 nurses, 400 public health practitioners, 800 patient care specialists or medical research coordinators, 240 pharmacists, and 200 oral health professionals. Our second objective is to reduce health inequities by expanding partnerships to rural and underserved communities. $5 million for the biennium. We are committed to serving the entire state of Minnesota, especially rural and other underserved communities. As has been stated, we have learned that recruiting providers from these communities and when health professionals who are trained in these communities, they are more likely to continue working in them. We will enhance our partnerships with organizations and providers to ensure all Minnesotans receive high-quality care by highly trained health professionals. Madam Chair, with your permission, I will now hand this over to my colleague, Melinda Pettigrew.
Welcome to the committee, Ms. Pettigrew, and please state your name for the record and begin.
Thank you, Madam Chair. For the record, I am Melinda Pettigrew, Dean of the School of Public Health at the University of Minnesota. Our third objective, which is for $8 million for the biennium, is to improve healthcare quality close to home. This is really important because in our current state of affairs, many Minnesotans do not have access to healthcare. Everyone in Minnesota deserves access to the right care at the right time, especially in times of great need. The university is uniquely positioned to improve the availability and quality of healthcare across the state, both through our own health professionals and by supporting other systems through our education, research, and partnerships. One example of this is the One Health Clinic. This is a place where people and their pets receive medical care together. The goal of these clinics is to improve health outcomes for both people and animals by recognizing that their health is interconnected. Working with interdisciplinary teams, human medical professionals and veterinarians work together to understand the needs of the individual, the whole person, and their pets. Unified healthcare plans. The clinic creates a plan that includes steps for both the owner and the animal's health. The first One Health Clinic was piloted in July 14, 2024, at the bond between Pet Food Shelf and the East Phillips neighborhood in Minneapolis. University of Minnesota College of Veterinary Medicine faculty and students examined 24 dog and cat patients, while medical and pharmacy students and school faculty cared for 6 people by providing blood pressure and blood glucose screening and consultation. One client was actually diagnosed with diabetes at this clinic, and this was a significant change that may have saved the person's life. Based on early results from a community needs assessment, pet owners share that they are actually more likely to seek care for their pets than for themselves, particularly when resources are scarce. The One Health approach can bridge humans getting the medical care that they need while also supporting pet health and the health of these companion animals that play such an important role in their owner's physical and mental well-being. Our fourth and final objective is to transform health outcomes through innovation in prevention, treatment, and care models. As Minnesota's research engine, the university continues to lead in health innovation, from pioneering the first health lung machine and developing breakthrough HIV treatments such as abacavir, to creating the first report card for quality of life in nursing homes in the state. We drive the health of future generations. With $10 million in additional funding, we will launch new targeted interprofessional and multidisciplinary research into prevention, treatment, care models, and cures for one high-need condition, and this would be determined in collaboration with the state. In addition, funds will be used to translate research innovations into practice by expanding connections with local healthcare providers and other partners. What is an example of this patient and community-centered work? It is the Center for Learning Health Systems Science. In 2021, the University of Minnesota Medical School and School of Public Health partnered to establish the Center for Learning Health System Sciences. It has since forged collaborations across the health science schools and other university schools. This includes nursing, pharmacy, dentistry, computer science, and engineering. It also features a training program for scholars in health systems at the 5 Minnesota health systems of Essentia, Health Partners, Hennepin Healthcare, the Minneapolis VA, and Fairview Health Services. It also features strong patient, family, and community engagement by working closely with groups such as the Minnesota Clinical Trials Network and the university's Rural Healthcare Collective. The first partnership of its kind, CLHSS, identifies challenges in healthcare delivery. We gather evidence on that challenge, and we implement a change to address this challenge. We evaluate the change by collecting data on its impact, and this includes firsthand data from those who are impacted. And those are members of the community. These are people. These are people-centered outcomes. It takes too long for published evidence-based practices to benefit people and patients. We want to speed this up and address the challenges that are important to the people of Minnesota. Since its inception just 3 years ago, the center has initiated or supported over 200 studies and partnerships of this nature. Madam Chair and members of the committee, I will close with this. We, as the University of Minnesota, and especially the health science deans, heard the directive from the task force and from you all, the legislature. We know that domestically and nationally, we are facing a shortage of healthcare providers. In addition to the shortage of providers, we face a maldistribution that leads to healthcare deserts and significant inequities in care. And we also know that this landscape is changing. For the first time in history, the number of Minnesotans age 65 and older has now eclipsed the number of Minnesotans age 5 to 17. In addition to an aging patient population, the healthcare workforce itself is also aging. Environmental changes are disproportionately impacting the least wealthy and most vulnerable individuals across the planet, and this is increasing inequities in care. Our state's health systems are facing historical financial and operational challenges, and as a public university, we are pivotal to leading and convening others to address these critical issues that the state is facing. So this is a summary of the request, and with that, Madam Chair, we thank you and the committee for your time, and we stand ready to address your questions.
Thank you all very much. Members, do you have any questions about the presentation or the proposal? Senator Abler.
I'm willing to go second, Madam Chair, if I don't, but I just have a couple comments. I won't reiterate my comments I made when the report came out. Maybe it's worth listening to those. I was one of the few to talk about it. But I think the U absolutely needs to be a leader, and there's resources beyond even just this request that you have, which I've alluded to. In your army of retirees who would like something to do that would be productive. They have a lot of free time. I have two good friends who are retired and they have nothing to do. They're not retired doctors in the U, but it would just be remarkable to take advantage of, for one thing, the historic nature of when healthcare was a service organization, to bring that back in as they look at the flavor of what you're trying to create with your partnerships. Well, Madam Chair, in a question, so did the governor pick up any of these things in his budget?
Ms. Delaney, did you want to answer?
Madam Chair and Senator, to the extent of my knowledge, these things are not currently in the governor's budget.
Senator Abler.
Thanks, Madam Chair. And in fact, the governor gave nothing to the U, which I find to be pretty shocking. He shifts $804 million to the counties to pay for nursing homes and other things, and expands the sales tax with a net increase, and I'm just really shocked. I think sometimes you miss Arnie Carlson, don't you? You know, he would have been right there with his maroon, and appreciate the leadership they have. And I'm not here to bash the governor. He made his choices, and so because it's not productive. at the end, we have to all work together. And I think none of us are aware of how it's going to be really at the end, how hard it's going to be to come up with a budget that balances out. And, but I'm going to just give you a thought. And so what if you go home with none of this? How are you still going to be amazing with none of this? I imagine at the end you'll have a little dribble of operational money that will come to you. I would certainly hope, and I will lobby for that within the restrictions of the budget. But zero, I think, is an untenable number. And I think that just shows I mean, I don't know if they think we're going to fight for it to help you out, and that was his political positioning, which I don't understand. But I don't know why he didn't give any money. But back to that army of retirees and your endowment, and I know you put most of it into the interest does something. It's not really free money, but I think for a pretty small amount of money, you could accomplish every one of those goals for probably buying a few thousand box lunches. And I'm not being facetious. The lean times are going to be with us for a while. And we won't even need to get why we got there. I think there was a bunch of overspending on things that were not as important as this, but that's done. So here we are with the budget that we have in front of us. And so I'm willing to argue for that on your behalf and encourage people and call to action. And it might even be that as you work on this on your own, you provide a model about how you can lead the way on a lean operation with a profound impact on the state, because it needs to be. So thank you, Madam Chair.
Thank you. Senator Port.
Thank you, Madam Chair. Thank you for your presentation. I think on slide 3, where the goal is to ensure that all Minnesotans have access to exceptional health care, we need that to be the goal, right? We need you all to be working towards that, and we should be doing our part as the state to help support that. I think my one concern here is, looking at sort of the how we'll achieve this goal. Nowhere in there does it talk about patient costs. And I think we have to acknowledge that one of the reasons that people don't receive care and are not healthy and aren't able to get the treatments that they need or even go to the doctor is because it's cost prohibitive. They can't afford it, their insurance doesn't cover it, they don't have insurance. All of the other things you said about it's too far away, there's not a clinic that's close. But cost is definitely a part of this. And I think we have to sort of have that conversation holistically. And I wonder if in your conversations as you were sort of creating these pieces, if that was something that came up, or if you sort of see that as separate from these goals.
Ms. Delaney?
Yes, Chair and Senator. I'm going to tie several comments together. One is that it is our intent to fully, unwaveringly convey that the health of Minnesotans is core to everything we're presenting. It is our intent to convey that the voice of the people and their home communities are core to everything that we've been presenting. And 3, it is our intent to convey our responsiveness to the Governor's Task Force on Academic Health at the University of Minnesota. And now to your specific question. So with this close and partnering relationship with the patients, families, and communities, and the commitment, as you see in these objectives, about accessibility and top health care, it necessitates the attention to this extremely complex issue of financing, and we will do it together.
Thank you.
Thank you.
Any other questions? Okay, well, thank you all very much. I do know that the proposal does have further details below the $22 million a year for number 1, and that you have that available if members are interested. I think you have more examples of what the specific request would fund or could fund. So if members have questions about that or would like more information, I hope that you'll reach out. Thank you again for coming before us today. I think it's essential that we discuss and face the fact that we do need to address the workforce challenges that we're facing. And if we don't try to innovate in terms of, translation of the research into care that was mentioned, if we don't fund adequately the pipeline to get more providers out, we won't be able to address the human aspect of access and, the cost of it. So thank you again for coming before us today. And now I would like to, we put this off from a earlier time, and I would like to not put it off again, to have our nonpartisan staff talk about the DCYF jurisdiction changes so that members have an understanding of that as we go forward and as we talk about the budget and policy items. Ms. Hoffman-Litchi, are you going to go first? Okay, thank you.
Madam Chair, members, on the wonderful, colorful document that says Department of Children, Youth, and Families program transfer, on the left-hand side and everything in green are programs either from the Department of Human Services, the Department of Health, or the Department of Education that have already transferred to DCYF. The new department was effective July 1st of 2024. And so all of these programs have started transferring. That's the Child Care Services Division, Child Safety and Permanency Division, Child Support, all the economic assistance programs that we're planning on being transferred. So those are all already transferred and are now sitting with DCYF. The central operations from DHS that are planning on being transferred have been starting to transfer July 1st and finishing up June 30th of this year. My belief is that there's like 4 different sections that DHS is transferring over. So that is ongoing. And then by June 30th of this year, the programs from the Office of Inspector General at DHS, so all of the licensing functions for child care and child foster care settings, and the program integrity units for the Children and Family Services Division will be transferred at that time, along with all of the programs from the Department of Public Safety, which would include the Office of Restorative Justice, the Youth Justice Office, and then some of their grants.
Thank you. And now, Mr. Bessel.
Madam Chair and members, so from Ms. Hoffman-Litchi's chart there, I'm going to talk just briefly about the green one in the middle. So she has 2 bullet points. My document is this one, which shows you what appropriation lines are within those 2 bullet points. And so for everything that came over from the Department of Education, there's $455 million of projected spending in the forecast for 26 and 27. When we, the fiscal staff, started looking at this list, we identified a problem, really, with this committee making all of those appropriations. And the problem exists because the highlighted components there have interactions with sort of global decisions the E12 committee could make with respect to levies and shifts and things that I don't know much about, other than that those are words that matter a lot to them. And so the highlighted in gray lines on this sheet, in the Senate anyway, and I think the House is doing a similar thing. Hopefully they're doing the same thing. The appropriations for those programs will still go to the Department of Children, Youth, and Families. They will just do so in the education bill. So the second section there where it says appropriations shows how much of that total $455 million will be, assuming the base is appropriated, would be appropriated either in the HHS bill, the $295.6 million, or the E12 bill, the $159.4 million.
Thank you. Members, do you have any questions about that? Oh, okay. Yes, of course, if you have questions, feel free to reach out to the nonpartisan staff, and they can go over this in more detail. But we wanted to make sure that that it was clear, the understanding of where the line items are at and the challenges with some of them, to just move them all over. So I appreciate your putting these charts together for us. And with that, seeing no questions, we have come to the end of our agenda, and this meeting is adjourned.